Check your state laws and facility policy to make sure you are permitted to perform this procedure. Before performing oral hygiene, check the care plan or the nurse's instructions. Note any restrictions or special considerations. Before you begin, practice hand hygiene. Identify the patient and make sure that privacy has been provided. Follow all additional instructions in the preparation section of this program.
Good morning.
Good morning.
I'm Ashley. I'm going to be your nurse's assistant today.
Okay, Ashley.
May I take a look at your armbands?
Sure.
And can you say your name and birthday for me?
Carolyn Koenig, October 11, 1946.
Okay. I thought we'd get started by getting your teeth brushed this morning.
Okay, that sounds good.
Okay, I'm going to go get all the supplies and I will be back.
All right.
All right, thank you.
Thank you.
When performing oral hygiene, place paper towels on the overbed table and arrange the necessary items on them.
How does that feel?
This feels good.
Okay.
For all types of oral hygiene, lower the bed rail near you if it's up. When assisting the person to brush and floss the teeth, first position her so that she can brush with ease. To protect her garments and linens from spills, place the towel over her chest. Then adjust the overbed table in front of her. Now let the person perform oral hygiene. This includes brushing her teeth and tongue, rinsing her mouth, flossing, and using mouthwash or another solution. When the person is done, remove the towel and move the overbed table to the side of the bed.
I'm fine, thank you.
When you must brush and floss the person's teeth, help him to a sitting or side-lying position as required. Place a towel across his chest and adjust the overbed table so you can reach it easily. After practicing hand hygiene and putting on gloves, hold the toothbrush over the kidney basin and pour some water over it. When the brush is wet, apply toothpaste to it. Now brush the person's teeth gently. For the outside of the teeth, hold the brush at a 45-degree angle to the gums and brush with short strokes. For the inside of the front teeth, hold the brush at a 45-degree angle and brush from the gum to the crown of the teeth with short strokes. For the inner surfaces of the teeth, hold the brush horizontally and brush the teeth back and forth. For the biting surfaces, position the toothbrush against that area and brush back and forth. Also, gently brush the tongue. Then let the person rinse his mouth with water as you hold the kidney basin under his chin. Repeat this step as needed. If the person desires, floss his teeth. To do this, obtain an 18-inch piece of dental floss from the dispenser. Hold the floss between the middle finger of each hand and stretch it with your thumbs. Then move the floss gently up and down between the teeth, starting at the upper back tooth on the right side and working to the left. Move the floss up and down against the side of the tooth and work from the top of the crown to the gum line. Switch to a new section of floss after every second tooth. Also floss the lower teeth using up and down motions as you did for the upper teeth. Again, start on the right side and work around to the left. To continue, let the person use mouthwash or another solution. Again, hold the kidney basin under his chin. When he's done, wipe his mouth and remove the towel. Finally, remove and discard your gloves and practice hand hygiene. To provide mouth care for the unconscious person, start by practicing hand hygiene and putting on gloves. Now position the person on her side near you. Also turn her head well to the side. Next, place the towel under the person's face to keep her gown dry. And place the kidney basin under her chin. With the padded tongue blade, gently separate her upper and lower teeth. Never use force. If you have problems, ask the nurse for help. After making sure the sponge is tight on the stick, moisten it with the cleaning agent. Then remove excess moisture, which can cause choking. With the moistened swab, follow these steps. Clean the chewing and inner surfaces of the teeth. Clean the gums and outer surfaces of the teeth. Swab the roof of the mouth, the inside of the cheeks, and the lips. Also swab the tongue. Next, moisten a clean swab and remove excess moisture and use it to rinse the person's mouth. After rinsing, place the used swabs in the kidney basin. Then remove the basin and the supplies. Wipe the person's mouth and remove the towel. To complete the procedure, apply lubricant to the person's lips. And then remove and discard your gloves and practice hand hygiene. Whether the person was able to perform her own oral hygiene or, if you assisted with oral hygiene, perform post-procedure care. For example, put on clean gloves and clean, rinse, and dry the equipment. For detailed information, see the section on follow-up care, reporting, and recording in this program.